When a tragedy such as this happens in our school district, members of the counseling team, they go to the school that's in crisis and they meet with the administration and with the counselors and the social workers that are in that building, and we decide on what action we're going to do that day. Usually it typically involves going into the classroom, supporting the teacher in any way that they need, whether it be just helping them tell the students what had happened, or just being there for when the teacher tells the students what happened. And then we ask the students if they have any questions, and we always stick with the facts. We never want, like sometimes students, they might start asking questions that don't have anything to do with what had happened, so we try to keep it totally fact-based to help them out. And we keep an eye on the kids, and if the teacher notices that maybe a student was really close with the person that was in the tragedy, we try to we pull them, we talk to them individually, and we pull a small group and talk to them that way as well. Well, sometimes we see students who don't seem like they're affected by it at all, but they might go home that night and they might break down and just start processing the situation. Or there are kids that immediately get it and they may, right in class, just be real acting differently, upset, just need to process that. Art therapy is a great way for students to express themselves. We pull the kids that are visibly upset at that time, pull them out of the classroom. We talk to them individually. Sometimes they prefer to talk in a group with their other friends. They just talk about just things that they just things that they remember, things that made the person special. Well, I think it's important to keep the lines of communication open. I think that it's something that the kids, you need to have the conversation with your child. You don't want to brush it under the rug and act like it didn't happen. I would have a conversation, ask them how they're feeling, ask them what they know, what the facts are that they know about it. And if there's something that they're speculating, I think it's important to keep to the facts, to keep an eye on your child. I think that it's hard for us all to process. Like, well, we don't understand what happened, and so for a student, especially that age, the 4th grade age, I think it's important just to keep an eye on them. A student that maybe is typically quiet becomes real boisterous and loud, or a student that never gets into trouble and gets into a lot of trouble, or a student that is loud and all of a sudden is real quiet. I think those are things that you need to keep an eye on, and if you notice that, then I think that it's important to maybe contact a mental health provider.